Hi Helen.
Hello.
I'm Brodie, I'm one of the doctors here.
Have you come to put my cannula in?
I have, yeah. So the nurses told me that your other one stopped working, hey?
Yeah.
So we'll have to pop another one back in, alright? So it does sting a little bit when they go in, as you know.
Yeah.
And what I need to do now is I just need to go away and set up a little area that we can use to put the new cannula in nice and cleanly, okay? So I'll go and do that and come back, and then we'll put the cannula in, and then we'll be away. Okay. Sound okay?
Yep.
Yep. Alright, so I've just cleaned my hand and we've just finished wiping over the hard surface here with the Tuffy wiper of Cannul, and then we're going to open the pack and put it on the surface, okay? So what we've got is we've got new cannulation packs. Basically they've got everything in them that you need to put in a cannula, alright? We're switching from the short bungs to the extension sets, mainly because that helps preserve the cannula, and it also is better from infectious control purposes. So all we need to do now is we're going to open it up and put everything out, okay? So the first thing you want to grab out of the pack is the same kits as we used to have in the trolleys. So basically within these, as you normally would with any drape, you open these up. Now this is not a sterile field, this is a general clean surface, okay? So open that up, alright. Then you grab your posi, your new flush, so your saline flush, drop that on there, your extension tubing, which we'll prime in a second, and your swab, which we're just going to keep to one side. The only extra bits you have to add to the cannulation kit is a single-use tourniquet, which then stays with the patient, and a cannula. So for demonstration purposes we're using a 22 gauge. The ones with the stripes are the new bloodletting ones, basically, where they've got the auto guard in there to stop the bleed back on them. Okay, so we're going to open that up and pop it on there as well. Okay, and now we've got a surface ready to go to take back to the patient. So you wash your hands again, and we're going to head back to Helen and we'll set up. So we've come back now to Helen. We're going to just prepare the site to put the cannula in. We've got our nice clean trolley here, so I'm just going to wash my hands first. And what we're going to do is we're just going to pop down a bluey underneath. So we've got a nice area underneath the arm that's nice and clean as well. So we'll do that. And we'll just get Helen to lift up her arm, but she's just fallen asleep on me, so I'm just going to lift that up for you. Okay. And next thing we're going to do is just pop on the tourniquet. So because I'm going to put it in a hand, I'm just going to put it up on a forearm here. If you're going to put it in the cubital fossa, you probably want to put it up a bit higher. So nice and firm there, but not too firm that it's uncomfortable. The next thing we're going to do is just going to swab the site. So we grab our swab, we'll tear our swab open, grab it out, and once we've picked the site here, so you can see on Helen she's got a good vein there, we've palpated that, it's nice and bouncy, we're happy we're going to put it in there. I'm just going to clean that there. So same deal with any cleaning technique. Start where you're going to put it in with big circles around it and make sure you get a nice clean area covering the whole surface. Okay? Now because I'm not confident that I'm definitely going to get it in without touching the hand again, what I'm actually going to do now is go and do a full scrub under the tap and actually put on some sterile gloves so that I can touch the skin again before I put the cannula in. Okay? Just before we do that too, just remember you have to release the tourniquet. You don't want to leave that up while you're doing that because it takes a couple of minutes. And when we come back, we're actually going to have to get one of the nurses or one of the team to come and give you a hand to tighten that back up because you're going to have sterile gloves on. So just remember when you go back, just grab someone to tighten it up for you. Alright, so Helen, I'll be back in a second. I'm just going to go and wash my hands, okay? Alright, so we've come back to patient Helen here, and I've brought nurse Helen with me. He's going to help me just by doing up the tourniquet again. And now we're ready to go. So we've got our sterile gloves on. Now if you were happy that you didn't need to touch the skin again, you're happy with where the vein was, you could just use normal gloves. Alright, but just remember your gown, your goggles and your gloves. We've got everything set up ready to go. Okay, so now we're ready to pop the cannula in. Alright, so we've got everything ready to go. We've got our cannula, we've got our extension set that is primed and ready, and our dressing all ready to go and our clean surface still. Alright, so what we're going to do, we know where we're going to put it in. So basically now what we want to do is, because I've got my sterile gloves on, I can palpate the site again. So I'm just going to palpate again, find a nice bouncy bit. I'm going to just pop some anchoring there on the vein, and without touching the skin with this hand, so keep this one nice and clean, through the skin nice and quick, into the vein. And as we push it forward slightly, you are going to get some flashback up into the chamber there, but you won't get flashback all the way up because this is one of the blood guard cannulas there. So then we just push this all the way through. So we want to advance that down, retract the needle, and because we're not going to get bleed back, you don't actually have to occlude up here. The next thing we want to do, if you wanted to take blood out of this now, this would be where you want to take blood. However, it's not ideal to take blood from a cannula. We prefer a clean stab if you can. If you do need to do it, sterile syringe onto there, draw back your blood, take that off, put your extension set on and then give it a flush, okay? And make sure you do let your tourniquet down. So now we're just going to keep the end here nice and clean. So remember the clean bits to clean bits, keep that nice and clean. Attach on here. Sorry, I've just obscured your view. Just skewer that on there, give that a flush. So just with your flushing, make sure you do your push-pause technique. So push, pause, push, pause, push, pause, and when you're at the last bit there, when you pause, then you need to just clamp off here. We're happy with that. Unscrew here, and then just make sure that you tighten that up there, and then we're going to pop our dressing on. Make sure you get rid of your sharps. I would usually put a bit of tape here as well to tape that in place, okay, so it doesn't get in the road for the patient. And then you're done, your cannula's in, you're happy, make sure you put a note in the chart and you're ready to go. The other thing, just if you weren't going to use sterile gloves, just remember that you don't have to pop sterile gloves on for everyone. It's only if you think you need to palpate again for difficult cases, all right? So that's it.